Today on 3Qs at the U, we're joined by Roberta Timothy, assistant professor at the Dalla Lana School of Public Health. Hi, Roberta.
Hi, Sam.
Today, we're really still at the start of the Black Lives Matter movement, which I hope will bring justice that's long overdue to Black people. What, in your professional opinion, what do we still need to know about the historical context of anti-Black racism and colonial violence?
The history of colonial violence started in villages throughout the African region, as families were brutally torn apart, separated forever on the shores of African enslavement ports. Through forced migration in the Middle Passage, where millions died, Africans were brought to British and French colonies, now known as Canada. In 1632, Olivia Lejeune, a young Black child from Madagascar, was said to be the first enslaved African. The Code Noir, an anti-Black racist policy, forced the conversion to Catholicism, and with other anti-Black policies, legislated the enslavement of Black people and restricted rights and freedom. The Slavery Abolition Act of 1833 banned enslavement of African people. However, the ideologies, practices, and actions of anti-Black racism continue to impact the lives and health of Black communities today.
Racism and anti-Black racism has been causing health disparities for a long time, for centuries. In the context of the current pandemic, how is that playing out?
Well, Black health disparities, or what I call Black health violence in Canada, directly relates to African enslavement and colonization. The anti-Black racism continues to create separate and unequal health systems and practices for Black folks in Canada. This leads to aggravated health conditions directly due to anti-Black violence, such as increase in diabetes, high blood pressure, lack of cancer screening, depression and anxiety due to police surveillance, and witnessing the deaths of community members on a daily basis are examples of anti-Black racism before COVID-19. Black people during COVID-19 are experiencing trauma, death, unemployment, mental and physical health stresses, food insecurity, racial profiling, and much, much more. Our essential workers are mainly in fields that have little power and pay, such as PSW, nursing, childcare, delivery, transport, and little or no access to protective gear. They are also working on the front lines in shelters, hospitals, and community health centers where anti-Black racism, health violence continues.
What does healing look like for your communities?
Systemic and institutional and organizational changes need to happen. Our communities have been resisting for over 400 years. Resistance, not resilience, is critical. Learning how to support our mental and physical health and how to survive and thrive strategically, protecting our wellness, is a must. Funding and supporting mental health programs that are culturally and politically appropriate. Healing for us is political. Keeping communities safe means addressing the lack of safety and structural violence in our lives. Addressing the social determinants of health, not only social economic ones, but anti-Black racism, as well as sexism, ableism, heterosexism, ageism, transphobia, Islamophobia, demonization of African spiritualities, and other forms of violence. Health reparations for past and present atrocities. Stop calling us vulnerable populations, visual minorities. Fund race-based data collection led by Black health researchers. Fund a national Black health strategy, which includes mental and physical health initiatives. Recruit, train Black doctors, mental health, public health practitioners. Confront anti-Black racism in hospitals, in universities. Reform our educational, child welfare, legal, and penal systems. Dismantle police systems that are not accountable for the death of Black, Indigenous, and racialized people. Decolonize our ideologies and practices. Resistance,